welcome to the Coronavirus Diaries. Today I have the honor to speak with a friend and colleague, Jean-Nicolas Beuze. He's the UNHCR representative in Yemen. Thank you so much for joining us today. How are you?
Hello, Marie. Happy to be in contact with you after 3 years in Canada. I'm now posted in Yemen, but I'm happy to reconnect with Canadians and beyond to speak about the coronavirus impact in Yemen.
So yes, today we want to speak about the impact of the virus, but also the ongoing conflict. So that's something I would like to start with. Even before the pandemic happened, can you perhaps remind us what the situation was and what the conflict was a little bit about? I know it's very complex, so you don't have to go on for 10 minutes, but just a little bit of information.
So just geographically, to remind everyone, Yemen is at the bottom of the Arabian Peninsula. And for the last 5 years, it experienced a conflict which has not stopped due to the coronavirus or due to the ceasefires call from the Secretary General and any other important personalities. So we are in the middle of a 5 years conflict. It's opposing 3 main groups, but to simplify, it's between the North and the South. Issues of independence, issues of control of oil production, issue of control of the port on the Red Sea. And as often in this part of the world and elsewhere, what was initially a domestic issue involving in particular different tribes having different vision for the future of Yemen, it became rapidly a regional and even a global conflict. And now the war in Yemen is a proxy for the competition between different regional powers and even the global powers. The conflict has displaced 1 out of 8 Yemeni. It's the 4th largest internal displacement due to conflict in the world after Syria, Colombia, and Congo. It's a conflict which has destroyed all the health facilities and the infrastructure, road, school, in addition to the hospital, as I mentioned. And as a result, 80% of the population, and the population is 30 million, relies on humanitarian aid for their daily survival, 80%, which made the UN call Yemen the worst humanitarian crisis.
Mm-hmm. So I guess the situation even before the pandemic was already very, very complicated for you, and the fact that there is no infrastructure and that you have to reach those populations that I suppose live in cities.
So the population lives partly in cities, but also in 1,700 sites which are hosting those families which have been displaced by the conflict. Mm-hmm. We are speaking about 42 active frontline as of today, which is definitely an element to take into consideration for us humanitarian, because we will never put our own staff or our partner staff, mainly Yemeni NGOs, at mm-hmm. risk by sending them close to the conflict. But the civilian population live near those front lines and is at risk permanently of being a collateral damage, if not a direct target sometimes, of the fighting in Yemen. It's complicated because the country, being at the bottom of the Arabian Peninsula, is well served by a port, but there has been an embargo on Yemen, and therefore everything that you need to bring to the country, from medicine to plastic sheeting tents to build those emergency shelters, becomes a logistical nightmare. The roads are difficult. You need to cross front line between the north and the south to bring vital items. And it's very complicated to reach those who are close to the front line, but also to reach those who are in the cities. A number of Yemeni displaced families, but also we have 280,000 refugees in Yemen, That sounds really incredible to think that people will try to seek refuge or asylum in a country like Yemen, but 280,000 of them, mainly coming from Somalia, have found a shelter in Aden and in Sana'a, the big cities, where they live really in extremely impoverished and dire situation. I visited one of the poorest neighborhood of Aden, and I've been to the favelas in Brazil. I've been to many parts of Africa, in Congo, but the misery I've seen in this impoverished neighborhood of Aden is beyond what I had seen previously.
Mm-hmm. And how, I mean, now we have the COVID-19 crisis, and we know that the important things are, you know, social distancing and sanitation and, you know, being healthy. So I guess it's only making the situation worse. And how many cases do you currently have, do you think?
So let me start with an important point, Marie, that you mentioned. All those preventative measures that we have applied in the Western world are
It's not
actually
possible.
impossible, absolutely impossible. First of all, there is no running water. So when you say wash your hands regularly, yes, but you have to fetch water probably by going for 30 minutes to a water point. And when you bring back the water, maybe you will use it to wash your vegetables or your food rather than to wash your hands. When you say practice physical distancing, absolutely impossible. We have people living in one single room, different families, or under plastic sheeting tents. You cannot isolate yourself. And if one member of the family is sick, that member will stay with you because there's not a second room where that person can go. Even for those who live in urban center, the tradition in the Middle East is that you live with your grandparents, your uncle, your cousins, and therefore there is no possibility for them to practice any physical distancing. But one thing which is also very important, stay at home, which is probably the best preventative measures, is impossible for people who rely on the little money they get in the afternoon to feed their children at night. They don't have money in the bank or under the mattresses to be able to survive even one single day. They live from the money they get during the day. With the slowing down of the economy that we have seen here in Yemen, like anywhere else, those displaced families and those refugees are the first one to lose their job. They were working in unskilled labor position in markets, in little restaurants, selling things on the street. This economy has completely collapsed. So there are no survival means. Now, in terms of the coronavirus spread, it's very difficult because the authorities in the south are releasing public information about people who are tested positive and the deaths. Because we have very few very little testing capacity, we measure, or they measure, only the tip of the iceberg. In the north, the authorities have decided not to release any information. Partly because they feel that it will frighten the population, partly because they probably were afraid of not having put in place and not having had the means to put in place preventative measures. So we have really very little information about the number of cases. What we know is that because of everything I mentioned before, which means that people cannot protect themselves against the coronavirus, but because people eat only once a day, because people have not been vaccinated, because their immune system is already very low, we know that the coronavirus is spreading very fast and killing a lot of people. We receive reports that people are being buried at night because there's really reprisal against families who have members who died suspectedly of coronavirus. There's a fear within the community. There's discrimination against refugees because they come mainly from Africa and Somalia. They are seen because of their on-the-move status as the one bringing the coronavirus into the community. And there's an element of racism as well. They are African, therefore they don't follow the same sanitary rules and so on. So there's all those misperception and myth around who can bring the coronavirus in the communities.
So that racism that existed, I mean, racism, the prejudice that existed before, that I know your organization had mentioned a few times, it's only worsened?
It's only worsened indeed. We can see that some people have been, some refugees have been denied access to health facilities. They are the first one to be called names on the street in the community when there is an outbreak of the corona or the suspected outbreak of coronavirus. We have seen that, interestingly and worryingly, with respect to internally displaced Yemeni as well, because they are seen as on the move, they are seen as the one bringing with them the coronavirus. So there is an element of racism for refugees, but there's also an element linked to the movement or to the migratory status, if you wish, of people. What we have seen also with the coronavirus is that people hesitate going to their health facilities. It's a mix of issues. First of all, in Yemen, you died of many communicable diseases. The world was engulfed into the coronavirus. At the time, Yemen was starting to get the cholera season, the dengue fever, the chikungunya, and the malaria. All those five diseases with coronavirus have the same symptoms: fever, maybe a bit of diarrhea, maybe a coughing, stomachache, and so on. People are used, unfortunately, to those diseases and are used to die from those diseases. So they don't always distinguish the coronavirus from other disease. On top of that, they know that the health facilities cannot do much for them. So why would you spend a little bit of money to bring your relative to a health center where you know that you won't be able to pay the medical fees? There's probably no medicine, and you still have 5 children and probably elderly parents to feed at home. So there's also a misperception on the part of the population, or misgivings rather than misperception of the population about bringing patients to health facilities, and we understand why.
And how, since the start of the pandemic, how has your role as a UN agency shifted? Before the pandemic, it was all focused on bringing shelter from conflict, and now I guess you have to also focus on the pandemic. So how is this a problem, and what do you do in terms of funding?
So we had to adapt all our intervention. For a lot of UNHCR work, it's related to interacting with people, interacting with survivors of violence, survivors of sexual violence, in particular women and girls. This has to be done on a one-to-one in a very confidential space. It's a lot about helping people to get access to services or to identity documents, which require really those physical interaction. So that had to be completely shifted to telephone calls. Instead of doing a distribution of shelter equipment in a group, we have to do it one by one, door by door, which means that it takes 4 or 5 times more time to distribute kitchen utensil or mattresses to people who have lost their home, which have been bombed in the conflict. So we had to change all that. And at some point, what was extremely difficult for me is that we didn't even have enough money to provide PPEs, the personal protective equipment, like the mask and the gloves and hand sanitizer, to my own staff and to the colleagues of the Yemeni NGOs. So how do you take the decision to send people out there in the communities with the coronavirus to try to help people who have lost everything? And a shelter is a critical need that needs to be rapidly addressed, but at the same time knowing that you may not be able to completely protect your own colleagues. So there were some really difficult ethical situation. We shifted to cash. We have a big and the largest cash program for internally displaced in Yemen. And that is really a good way of helping people. Because with the bank, we have been able to space the collection of the money. So instead of doing it over a period of 3 days, no, the collection of money for the same number of people is done over a period of 15 days. So we calculated that they spend less than 21 minutes at the bank to get their cash. So they interact with less people. There's less risk that they catch the virus. We have put hand washing station in the bank. So we can also educate people about how to wash their hands properly and remind them. Sometimes we give them a soap or an hygiene kit so that we make sure that they are equipped against the coronavirus. And the cash is really important because it allows them to probably limit a little bit their movement. They don't need to go out to look for a job every day. So the socioeconomic element, but also it protects them against the discrimination that we were discussing before, of not exposing them to other communities and being finger pointed as the refugee or the displaced, who is a risk for the community. But as we speak now, we are only 1/3 funded. We are almost end of July, so we won't be able to finish the year with helping the most vulnerable. We are lacking 70% of the funding.
Yeah, and considering that countries are, I mean, I think even before the pandemic, there wasn't a lot of attention paid to the conflict. And now, with every country focused on their own problems and their own economy, it's going to be even worse, probably. Are you expecting funding from anyone, or?
Now you are pointing out to a very worrisome trend that we see all over the world in terms of humanitarian funding. As you rightly say, Marie, we fully understand that Western economies, but also the Gulf countries, which have been in the past generous donors in Yemen and elsewhere, worry about their own economy and the impact of the coronavirus on private businesses. We do recognize that there is a need to invest more in public health system, in supporting the elderly, and so on and so forth, and persons with disabilities, which have been particularly affected during the coronavirus. Having said that, we still believe that there is a humanitarian and ethical imperative to help Yemeni, like a Rohingya in Bangladesh, or people displaced in Central African Republic or in Syria, or closer to Canada, the millions of Venezuelans who have fled their countries, and all those who are coming from Guatemala and El Salvador or Honduras to Mexico, trying to move up towards the US, which is made impossible now for the search of safety. So we really understand this point, but there's still, at least I believe, an ethical imperative for us to help people who are even in a more dire situation. But there is also a self-preservation imperative, one which is related to public health, global public health. As it was said several times, nobody will be safe from the coronavirus if not everyone is safe from the coronavirus. Therefore, Yemen, as a few other countries, may be the weakest link these days. And if we leave a hotbed of coronavirus in Yemen, you can be sure that one day or another, this virus will come back to the Western societies, to the Gulf countries. Yemen is a crossing point. A lot of Eastern Africans are using Yemen as a migratory route to go up the Arabian Peninsula, the Middle East, North Africa, perhaps crossing into Europe, or perhaps crossing into West Asia. So we are going to be weak globally as long as we don't protect a country and support a country like Yemen to fight properly the coronavirus. But at the end of the day, we won't be able to fight any of this misery in Yemen as long as there is a conflict.
And in the meantime, the conflict obviously is still going on. Are there still daily attacks, or and how do you respond to them, considering you have also to focus on the pandemic?
We have seen actually no lull in the conflict, despite all the appeal to ceasefires, including during Ramadan, which is usually a period of time where people stop fighting as per the tradition. We still see almost every day bombing and fighting and shelling and fighting on the ground, and people being displaced. We get bombing regularly here in Sana'a, in the capital, mainly at night and in the morning. So the conflict is certainly the root causes of all the miseries. I mean, coupled with the underdevelopment, because Yemen has not benefited for decades of any serious development effort. But the two combined, so underdevelopment and conflict, means that we are in a terrible situation not to address the humanitarian needs. But as long as the conflict lasts, we won't be able to address the underdevelopment aspect of it. So rebuild the health system, have a functioning central bank so that we have a proper economy, building school, and so on and so forth. This is not possible to do when the bomb is still being dropped on the civilian population. So for the time being, and that's really the focus of UNHCR in Yemen, we are trying to address the impact of the conflict and to some extent try to mitigate or to build the resilience of those populations against the impact of the conflict.
And one last question, perhaps. I mean, you know that eventually, perhaps we'll get a vaccine. My fear is obviously that the vaccine will go to Western countries first, depending on who finds it. In your experience, in terms of vaccines, when do you think, or where do you think the focus will be on giving it to access to that vaccine to refugees and IDPs?
I think many have called for the vaccine to be a common public good and be distributed at low cost or no cost, preferably, to the entire population. Because again, it's the nature of the infection means that as long as not everyone is protected, everyone will be at risk of contracting or recontracting the virus. No, the difficulty in a country like Yemen is the logistic of bringing the virus, then the logistic of asking people to come to the health facilities. As we mentioned previously, there's a bit of misgiving by the population about what they can get from going to a health facility in the first. In the middle of conflicts, it's going to be extremely difficult to do a vaccination campaign because, again, we won't want to put at risk the nurses and the doctors by sending them too close to an active front line. So it will take time if a vaccine is developed and put at the disposal of a country like Yemen for us to be able to vaccinate everyone. And in the meantime, it means that we leave really literally millions of people exposed to another layer of misery. And that would be, perhaps that's my last point, is that really the coronavirus in Yemen is really the last straw, which is probably going to break the camel's back in the sense that people are very resilient. I mean, it's admirable to see the Yemeni, the parents, children, the refugees, the Somali refugees, how resilient they are, how the resources that they find to survive. But honestly, it's difficult to see in the medium term. We're not speaking really long term, but in the coming weeks and months, how Yemen is going to survive with this additional layer of complication that the coronavirus has brought at a time the international community has not committed even half of the money that we need to provide life-saving intervention till the end of the year, not even half.
Mm. And just final point, I know you meet a lot of people over there. Is there someone or a person or that stood out for you? Some story that you've heard from someone that perhaps you want to talk about? Because I know it's important for people to understand, to try and connect with the people on the ground. So perhaps if you have one story or one person that stood out for you.
A few, more than a few of them stand up, because, as I said, I mean, the courage of the people is incredible. We have, for example, Saad is a Somali refugee, and he is driving the ambulance to bring refugees, but also Yemeni who live in those impoverished neighborhoods where refugees and Yemeni live side by side, to bring them to a hospital. And we had a young Somali man who probably was infected with the coronavirus, had an underlying medical condition which required regular medical checkup, and Saad stayed with him till the last moment to make sure that he will not die. And I get, sorry, a bit emotional, that he will not die. That he will not die alone, because he was a Somali young man without any family. And the story continues that Saad and another group of people, including Yemeni, wanted to make sure that he will have a decent or dignified burial. So, and in the Islam tradition, you go fast to the mosque and you do all the ceremony and you bury the person. Because he was suspected of COVID, the whole group was arrested, detained, and put in quarantine, just for having tried to give a decent farewell to one of their brothers.
I'm very sorry. Have you lost a lot of people close to you, or?
We have a number of UN colleagues who died from suspected COVID. We don't have always the tests, the capacity of the tests. We didn't have medical equipment. It's coming now more and more, including for national colleagues and who are really in the front line and who live in the community with the coronavirus. We lost some life. We have a number of colleagues who got sick. Yes, it's difficult in those conditions to continue delivering those life-saving intervention with everything which is on our mind. Plus the bombing. I mean, I just want to say, a couple of weeks ago, they were bombing late at night, pretty loud one, and I was in contact with my national colleague out there, and one of them and mother told me there was just a moment my kids were falling asleep. Again, I'm going to spend sleepless nights trying to reassure them that they are safe. And this colleague the following morning has to go to the office and leave the children behind, because she has also functioned to assume vis-a-vis the rest of the Yemeni population and the refugees. It's tough.
Well, Jean-Nicolas, I want really to thank you for all your work and for joining us today. We'll share this widely to let people know about what's going on, and hopefully they can do a little bit of their part too. I know a lot of people are home these days, so I hope they'll watch this. So thank you again for joining us today.
Thank you, Marie.
Bye-bye.
Bye.